PRP is not a one-size-fits-all solution. It's a precise tool that shines for specific conditions. Think of it more as a sniper, not a shotgun. It is not magic pixie dust that can heal anything and everything. People always ask me, or maybe tell me, that they want to offer PRP and they just don't know how to market. Educate. You don't have to advertise. It's just education. Pro tip, look beyond the surface. Platelet-rich plasma is revolutionary, but it's not for everyone. I've seen how transformative platelet-rich plasma can be, not just for patients, but also for medical practices. However, the magic lies in one crucial step: choosing the right patients. I'm Dr. Ariana Demers, the Queen of Orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. So today we're going to talk about selecting the right patients for PRP treatments. We'll discuss key selection criteria, innovative marketing techniques to attract the right patients, and preparation strategies to ensure that they are informed and ready for the treatment.
Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us.
So the question is how do I select the right patients for my PRP treatment? My colleagues ask me, how do I know who's going to do well with the PRP? And PRP is not a one-size-fits-all solution. It's a precise tool that shines for specific conditions. Think of it more as a sniper, not a shotgun. It is not magic pixie dust that can heal anything and everything, just sprinkle it on. And this is where discernment from the practitioner comes in. Defining the ideal patient for platelet-rich plasma involves considering factors that maximize the effectiveness of the therapy and align it with its intended benefits. So here's how you can kind of define that ideal patient for PRP. The indications that I like to think of include conditions like arthritis, especially the mild to moderate stages. We know and we've seen that PRP can delay or avoid surgical intervention. One of my favorites is tendon injuries like tennis elbow or gluteus medius tendinopathy. Those in my book are rock stars. Those outperform nearly every other application. Ligament strains, these can offer a natural, minimally invasive alternative to healing connective tissues like that ulnar collateral ligament for the little leaguer's elbow, MCL ligament, ATFL ligament. These are all great applications. And then chronic pain syndrome, where PRP can provide pain relief when maybe traditional approaches fall short, such as comprehensive therapeutic treatments for low back conditions. So before we get too far along, I am going to recommend a thorough history. Right? You really want to dive into their medical history. You want to make sure you know exactly what treatments they have tried. Are they recovering from any recent injuries, chronic injuries? Have they exhausted all conservative therapies? And your goal is to align their needs with the strengths of the treatment. I would also recommend considering age and overall health. And while age isn't a barrier, younger patients tend to respond more robustly due to higher cellular activity. But don't discount older patients who might meet the criteria. They do great. And the real question is are they healthy enough to heal effectively? And if they're not, then are there modifiable things that we can start to guide the patient towards health? Pro tip, look beyond the surface, right? Conditions like blood disorders, active infections, chronic illnesses could complicate those outcomes. So just make sure that we know all of the things that could tip the scale in their favor or have less good outcomes. So a detailed evaluation just really ensures that you're setting yourself and your patient up for success. Next, we talk about the expectations and goals. Patients should understand where PRP fits in the overall strategy for helping with the musculoskeletal injury that they're experiencing, and understand that it is not an instant cure, that it can't regrow cartilage. And then also take into account their willingness to follow your post-treatment guidelines, participate in physical therapy, avoid tobacco and alcohol. Those are all going to be really, really important and do have an impact on their road to recovery. People always ask me, or maybe tell me, that they want to offer PRP and they just don't know how to market. So they got to get a marketer to come in and help them out. And so what I want to tell you is, please back that up a couple of steps, because step one is to identify your ideal patient. Once you have identified your ideal patients, then we have to also identify who your perfect patient is. And how are you speaking to them? How can they find you? How can they see the value of PRP therapy for them? And so it's really, really important to first identify who you're speaking to. And this is something that physicians really struggle with. And so in the marketing world, it's called an avatar. In my world, I always call it the perfect patient. So there's a number of pieces to this that are hard, and I think we struggle with this. So number one, who's our perfect patient? And the question that we've never had to answer is, who do we like to treat? We've never gotten to just say, well, I only want to see these, because our schedule is just open to whoever schedules. Whoever calls and there's an opening, they come in and we see them. And so doing a little bit of that hard work to say, okay, I really like to see these patients, and I know that I can get really good results with platelet-rich plasma therapy for these types of diagnoses. I know it's going to be a home run. Once you've identified that, think about somebody who has that diagnosis that you really like. And if you had a practice full of people just like them, you would be in heaven. That is what we call our perfect patient. In the marketing world, it's called an avatar. And so now we have this person in mind, right? We know what their name is, how old they are, and we can speak actually directly to them. I think the thing that physicians really struggle with is like, well, if I speak to them, then I'm going to ignore all the rest of my patients. And that's not true. Just because you're speaking directly to the patient that you know you can help perfectly doesn't mean that other patients aren't going to listen and it's not going to resonate with them either. It just might not be perfect. There may be one thing that doesn't apply to them, but they still hear you. They still hear your message. They still want what you're offering.
Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us.
Once that's done, the next step is not to just create some flashy ads, but create meaningful educational content that resonates with your audience and builds trust with your perfect patient, so that when they come across your advertisements, your educational series, they feel like they are being spoken directly from you to them. And they can't help but be like, oh my goodness, this person knows exactly what I'm going through. This person knows exactly what the solution is. I need to call them today and get my problem solved. And so if we're going to provide that educational content, here's some steps that I just want to kind of reiterate. Educate. You don't have to advertise. It's just education. I call my sales and marketing department my education and guidance department. And really, that's all we're doing, is we are educating our patients on what it is and guiding them to the proper choice that is best for them. You can position your platelet-rich plasma program as a solution to your perfect patient's problem, because it is. And you can make your education your cornerstone. So you're educating your patient on what they have, why they have it, and why platelet-rich plasma might be the best solution for them. And you can help your audience understand that PRP can be helpful by addressing their concerns. What is it? Who can benefit from it? What exact results might they expect? And so really inexpensive way to start is with social media, right? These social media platforms can be powerful, and they can connect you to much larger audiences than you can reach with print media or flyers in the gym. And they can showcase your expertise. They can show what you are knowledgeable about, what you're passionate about, and why they should come see you for this thing that you love to help patients with. And so definitely when you're on social media, you can create these visually appealing videos that explain the benefits. You can use before and after visuals or testimonials. And that really helps. The testimonials are really, really helpful to build credibility as well as trust. Because while you can say that you're great, if someone else says you're great, that is something that you can trust more often. Next, when you're making content, educational content for your patients and your perfect patient, just make sure it's easy to understand. Simplify the PRP concepts for the average Joe. Maybe make sure you can use content to explain how PRP is prepared, maybe how it's administered, how it promotes healing. You can use a lot of analogies, or you can say like comparison of, oh, this is what it does. PRP can jumpstart your body's natural healing repair system, or something to that effect. And then finally, build emotional connections. So you can build emotional connections with your patients or your to-be patients by showcasing your success stories that highlight how your patients return to their favorite activities after PRP, or highlighting the emotional reason why patients come to see you in the first place and how they feel after they've had a successful treatment. And so you can help them like envision their own recovery, like messages like imagine running pain-free, or reclaim your activity-driven lifestyle without surgery. Limited downtime for the busy professional, those kinds of things. And when people feel informed and empowered, they're more likely to trust you and are more inclined to do business with you and choose your services.